Welcome to PCR London Valve. We're here to talk about Edwards Pascal repair system. My name is Lars Søndergaard. I'm an intervention cardiologist from Copenhagen in Denmark. I'm here with my colleague and good friend Philipp Lurz from Leipzig in Germany, also an intervention cardiologist. So Philipp, maybe you can start just explaining the Pascal system, how it works and what's the indication for this.
It's a transcatheter repair system designed to reduce mitral regurgitation. It's applied via transfemoral venous access. The principal basis of the procedure is leaflet approximation. We have some specific device design features that includes a spacer. That's the name of the central body of the device, which is supposed to fill in the coaptation gap. And then the leaflets, they are grasped between the spacer and broad and contoured pedals. What's unique about that device is that you can grasp leaflets independently, so one after the other. That's certainly a new feature. And you can also elongate it. So by doing that, it goes down to a small profile, to a low profile, which comes quite handy when you have a quite busy subvalvular apparatus, which should improve safety as well.
So what kind of patient are you looking for using this system?
In general, in our experience so far, it can be applied in a variety of different pathologies, certainly in FMR, in DMR, and also in mixed pathologies. This is early experience, obviously, but it has been assessed, the safety and efficacy in the CLASP trial.
Maybe I can just explain that the CLASP trial included a patient who was treated with the Pascal repair system, and all patients had severe mitral regurgitation, very symptomatic patient, and it actually showed it had a very good outcome, procedural success in 96% of the patient, and with a significant reduction in the degree of mitral regurgitation. So at 6 months, we saw that 98% of the patient actually had less than 2+ or less mitral regurgitation, and 81% of the patient had only mild or less mitral regurgitation. So very efficient, and not only efficient, also a very safe procedure. 6.5% had an adverse event. So in total, I would say it had a good and also very good symptomatic relief for the patient.
It's actually quite an important, an interesting point that we, in general, when we assess these procedures, that we move a little bit away from an adequate result, which is normally MR2 or less, and give a little bit more attention to an optimal result, which is defined by mild or less. And it's good, as you said, that we see here 81% of patients with mild or less, which is actually what we really want to achieve in these patients.
I know there's going to be a CLASP 2 study. Maybe you can shortly explain how that's going to be designed, Philipp.
This device now is entering real world, and there are hundreds of procedures already performed, but it in general has to be put on a little bit more solid scientific grounds. And I'm happy to see that this will be done with a large randomized trial program, the CLASP 2D and 2F trial. The 2D trial will enroll mainly patients with DMR, with degenerative mitral regurgitation, and then the CLASP 2F part of it will assess functional mitral regurgitation. More than 1,200 patients will be randomized, and this is a head-to-head comparison between Pascal and the MitraClip. So we will get much more insights into the performance of the Pascal device, but in general about leaflet repair technologies in mitral regurgitation.
So exciting time, both for us as interventional cardiologists, but also particularly for the patient who may benefit from this new technology. So thank you for joining us here at PCR London Valve.